22,391 new infections. That is quite a high. It represents, and this is another high, a 29.8% positivity rate. So nearly 30% of all the COVID tests done in the past 24-hour period are testing positive. Those numbers continuing to climb. The Coronavirus Command Council is meeting to discuss whether to impose stricter measures to control Omicron, which of course is now driving this fourth wave. I'm joined by Dr. Jeremy Nell, an infectious disease specialist at Wits University, also works at Joburg State Hospital, Helen Joseph. Doctor, thank you so much for your time. I mean, gosh, these numbers, 22,391 new cases. In Gauteng, astonishingly high as well, 11,791. KwaZulu-Natal has jumped very high, 2,756, and the Western Cape, 2,194. This increase is so astonishing. It's quite hard to get a grip on it. When you hear numbers like this, what do you think?
Yeah, I mean, the numbers are shooting up in a way that we haven't seen in previous waves, even. The rate of increase has outstripped even the Delta wave and the Beta wave before that. So the total cases are shooting up really, really quickly, and that's probably as a result of perhaps some increased transmissibility even over Delta, which is no mean feat, and then also probably some degree of immune evasion to the extent that it allows for reinfections. The big difference, though, that we're seeing between the caseload this time and the caseload in previous waves is that this one doesn't seem to be, so far at least, and touch wood, associated with the same degree of severity that we've seen before. So although the caseload is shooting up, the burden on the hospital as regards COVID really isn't keeping up with the cases, which is really, really good news so far, although it's still early days.
Yeah, couldn't it just be that the numbers have risen so quickly that we haven't seen the virus do what it does over time? I mean, I think it's been, 2 and a bit weeks since we heard about Omicron, maybe a little longer, and it's normally after 2 to 3 weeks, am I right, that we start to see serious cases if they're going to develop into serious cases?
Yes, that's a really good point. And so the caseload always, on the hospitals is always about a week behind the diagnoses, and then the death rate, as horrible as that is usually a week behind that. But even accounting for that, and that is a very good point, and that's one of the reasons why we have to be circumspect. Even accounting for that, though, there does seem to be a difference this wave. And again, whether that's due to the amount of immunity that we have in the country now, thanks to a lot of previous infections and a moderate degree of vaccination, or whether there's some other factor in play is not yet clear. But it does seem, even accounting for the delay in hospitalizations that you would assume, that there is it does seem to be less severity this time around, at least as far as we can tell so far.
Interestingly, I spoke to Netcare CEO Dr. Richard Frieden last night, and one of the things he'd said about this fourth wave is it feels different on the ground. You're also on the ground at Helen Joseph Hospital, one of the large hospitals here in Johannesburg. Talk to us about what you're seeing regarding COVID admissions.
Sure, and again, just to put in context, obviously this is just what we're seeing anecdotally, and so the answer will be in the data, and we'll know a lot more in the weeks to come. But certainly, I do agree that it does feel different with the amount of cases happening in the community. We haven't had the same burden. Of course, we're still getting some people admitted with COVID pneumonia, some very sick, but the proportion just seems much less than previous waves. And again, this is an impression I've got. This is borne out by some of the early data, but it is early, and you certainly wouldn't want to commit to that until we've got a little bit more time to analyze the data. But so far, so good. Cross fingers and touch wood. It doesn't mean that there's no severe cases. Of course there are, and it certainly doesn't mean that people should relax about things like vaccination. Of course, they should be running to the vaccination stations if they haven't already, because for all we know, the decreased severity is precisely because of things like vaccination around this time.
Yeah, that's a very good point. Talk to me about preparations at Helen Joseph. We know that Helen Joseph has taken quite a lot of strain because of the problems at Charlotte Maxeke. Of course, there was that fire earlier this year, and I think it was a couple of weeks ago, there was a burst pipe and a flood through a number of wards. How is Helen Joseph coping at the moment in terms of how many people are filling up your wards, and what are the plans going forward?
Yeah, I mean, I can't speak for the whole of Helen Joseph, but it certainly has been a strain on the hospital, which is, right nearby Charlotte Macleay Hospital, and so the burden fell disproportionately on Helen Joseph when the other hospital closed, and I think that was certainly a big concern going into this fourth wave. I haven't seen a huge degree of progress with Charlotte Hospital, and it's still not fully open, and that's a big worry. If we get off a bit lighter this wave, that'll be good. But we are still seeing, even outside the wave, increases of 20, perhaps 30% admissions to Helen Joseph than we were seeing before because of the closure of the hospital. So can only do so much. There's only so many beds in the hospital. But after 3 waves, the hospital's pretty good now at being able to expand as much as possible, as humanly possible, if should the need arise.
We've spoken to a number of hospitals, and Netcare told us this, Chris Hani-Baragwanath told us this. Are you seeing the same pattern in your hospitals as well with Helen Joseph, that the majority of people who are getting really sick from COVID are the unvaccinated?
That's certainly the impression we have. And again, I think that one of the challenges with analyzing this data is that the vaccine data on EVDS is kept separate from some of the other data. So it's actually quite hard for the researchers to make that connection robustly. But certainly from what we're seeing, there is a disproportionate effect on the unvaccinated. And that's what we'd expect. That's what you've seen across the world and in many, many countries, including South Africa, that vaccination is one of the key ways to prevent severe disease. It's not 100% effective, but it's very much more effective than most things, and it's certainly a lot less risky than trying to get infected naturally, which is something we certainly wouldn't advise.
So we know that the President and the National Coronavirus Command Council are meeting, and we are expecting to hear from the President. It's not too clear what he's going to say. Many believe that he's not going to do anything drastic, certainly not a travel ban, bearing in mind he's been so critical of the UK putting us on their red list. But from a sort of a clinical perspective, what works? What helps you in the hospital setting when you're dealing with lots of COVID cases?
It's a really good question, because I think the answer is becoming clearer with time, that the virus is not really possible to contain at a population level. It's not. There's many infections which are like that. And initially, the hope was that if everyone had a strong lockdown and got enough vaccinations, that the virus would be eradicated. That just doesn't seem possible. So really what it's about is mitigating as much harm as possible. And there's a couple of ways that definitely do work and that really do help us. One is vaccination, no question of that. Other is mask wearing, especially around indoor areas where the circulation isn't good. Outdoor mask wearing much less important, but indoor certainly very vital. And then around the peak of a wave, like it is now, probably avoiding large-scale indoor gatherings. And that really does seem to be sort of a focus that you can get for these super spreader events, which just can bump the amount of infections up to the next level. There's not a lot else that helps, at least with our current understanding. Travel bans certainly don't help. The international community was, I think, woefully misplaced in doing this, and certainly wouldn't help locally. It's already in every province. Things like alcohol ban may work somewhere around the peak of the wave, just to take the push off the ICU, but really isn't a long-term strategy at all. So there's really a limited number of options. And I think if we look at the hospitalizations, which are not shooting up, and we need to concentrate on that sort of marker of severity rather than the total caseload in deciding what measures to enact. And so as long as the hospitals are managing to cope, I hope that the restrictions aren't strengthened any more than the few things I mentioned earlier.
All right. Well, thank you very much for chatting to us. Astonishingly high, quick increases with what seems to be the Omicron variant, which is now dominating. But as you say, still on the ground at this point in time, not hospitals overwhelmed. Thank you so much, Dr. Jeremy Nell, an infectious disease specialist at Wits University, also works at Joburg State Hospital. Helen Joseph.